first I have to say, I don't have the exact numbers, but what I can say that we have a very significant outflow of exodus of medical professionals currently in this current space. We understand that it is a global phenomenon. However, for Fiji specifically, trying to reverse the outflow remains a huge challenge. So we have outlined in a number of our write-ups what are the immediate mitigation measures. And some of the immediate mitigation measures does involve increasing the cadre of non-clinical staff so that they can take on the clinical duties of non-clinical duties of the nurses and doctors that have gone, and it allows the remaining group to focus more on their clinical duties. Even small things like running a patient from labor ward down to the theatre, we try to avoid having doctors and nurses doing that. We try to get the doctors and nurses just to be pre-positioned, ready to deliver the service that they want to do, and other people to carry out the non-clinical duties. That's one thing. The other one that we had been looking at for quite a while is establishing also increasing the number of community health workers that would be able to engage with our primary health care programs. And that would allow, again, a lot of our public health, primary health care nurses and doctors to be able to focus on their clinical duties and leave the non-clinical duties outside. We also have a big cadre of health inspectors that are and other graduates who are not currently employed, who have graduated but not employed. And again, that's another space that we want to look at. We had hoped that we would be able to look at some of our retired cadre, but many of our retired cadre are also being attracted by the conditions that facilitate the exodus of medical professions. So in general terms, those are the areas that we are looking at to mitigate the immediate effect. In a more longer term, there is retention strategies that we are discussing with, that we will be discussing with Ministry of Civil Service. We had started some discussion earlier, but now we've given the need to redraw the recruitment framework. We will have to discuss these issues again with the Ministry of Civil Service.